Wherever you live, your health is impacted by the environmental. Around the world, more than 50 million people die every year from disease, and nearly one quarter of those deaths are directly caused by environmental factors. Can you imagine? That's 1,400 deaths every hour of every year from an unhealthy environment. The hardest hit are those in low and middle income countries, especially in Africa, Southeast Asia, and the Western Pacific. And the young and the old are most severely affected. More than half of the world live in urban areas and can face heavy traffic, air pollution, poor housing, and limited access to the clean water and sanitation. Many work in the informal sectors under dangerous, dirty, and demeaning conditions. We all face the impact of chemicals and poisons, radiation, and poor farming practices. And climate change means our very uncertain future. Health is a state of complete physical, mental, and social well being, not just the absence of disease or infirmity. And good health is something we strive to achieve, not just individually but also as a community. But if we look around us, our family, friends, and others, we know that health is very variable. Social determinants of health are shaped by the distribution of money, power, and resources. And at international, national, and local levels, these can lead to health inequities, which is the difference in health between different groups of people that is unfair and avoidable. Let's take a look at the social determinants of health using a framework developed by the World Health Organization. According to this framework, there are two broad groups of health determinants: structural and intermediary. Structural determinants are the socioeconomic and political context that people live in. It includes governance, economic, social, and public policies, and also the social and cultural values placed on health issues. These factors can lead to the unequal distribution of material and monetary resources, which can shape a person's socioeconomic position. Socioeconomic position is characterized by education, occupation, income, gender, race, or ethnicity, and social class. The structural determinants of health operate through the set of intermediary determinants that impact a person's exposure, vulnerability, and outcomes to factors affecting their health. This includes material circumstances such as the quality of housing, the financial means to buy the healthy food, clothing, or other requirements for healthy living and work environments. Psychological factors like stressful living circumstances, relationship and social support, behavioral and biological factors. In addition to this, health system determine the type of health care, the quality of it, and how easily accessible it is. Bridging the structural and intermediary determinants, our social cohesion and social capital. The links between all these determinants are not always linear, but can be complex, interdependent, and interact in many different ways to influence health. For example, our income can limit opportunities for achieving good health, and conversely, poor health can limit opportunities for people to participate in the workforce. And remember, these determinants can act across the course of people's life. So, now we are at the crossroads. Things can continue getting worse, or we can work together to improve our world. Simple measures can be taken immediately to protect our health, the environment. We can reduce our consumption and clean our air by using sustainable fuels and walking or cycling more. We can safely store toxic substances in our homes and workplace. We can protect our water resources by disposing of waste appropriately and introduce clean energy technologies. We can bring multiple government sectors together to ensure all policies, activities support health. Let us all work together to improve our health and well-being. Make a healthier world for everyone.